Hello, everybody. Welcome to King County Recovery Conversations. My name is Christopher Archiopoli. My pronouns are he, him, his. I'd like to thank the King County Recovery Coalition, the Washington Recovery Alliance, Temple of the Trees Studio that's hosting us here today, and the King County Behavioral Health and Recovery Division. Today, my guest is Javan Jones. I have known Javan for going on 4 years now. Got the opportunity to meet him when I was working at Peer Seattle. Got excited about the work that he does. He is a peer and has his own organization, Jones Community Solutions, and just an all-around inspiring person. So I can't tell your story as well as you can tell your story. So I guess, first thing is welcome. Thanks for being here. And tell the people a little bit about you and your story and kind of whatever you want to talk about, just to start us off.
Okay, well, I'll introduce myself. I'm Javan Jones, the owner and CEO of Jones Community Solutions. I'm very proud of that. January 1st this year, we have made 13 years in service for the communities.
Wow.
We are very intentional about the work that we do and the services we provide to the underserved and the rural populations, I guess, in our entire world. Yeah, we work for everybody. JCS is the only Black-owned behavioral health agency in Washington State. We're a training agency. We focus on higher education and continued education for all professionals under the behavioral health umbrella, including mental health providers and substance use disorder professionals. So we do the certified peer support specialist, the newly licensing opportunities for the peer support specialists, the crisis awareness. We've written different curriculums with involving equity and culture. We have several different programs where we make sure that the community also understands that we're not just an agency. We're peers for the peers that provide support. We're peer supporters for the peer supporters. And we also make sure that the communities that we service has the opportunity to not only receive the services, but also have the opportunity to be educated, certified, licensed, employed, and also become providers as well, or work for providers. That's just a start.
That's a lot already. If that's just the start, what else is there? So you said JCS has been kind of happening for 13 years. What started this out 13 years ago? Because, the peer movement, really is kind of newish in a lot of ways. So for you to have been, at the forefront of that 13 years ago, like how did you get your start?
I got my start, I would say on accident, but it was very intentional the way that we work. When I say we, JCS, us, my wife and I, Annette Jones, the wonderful inventor and creator of all things community life and peers on peers. We had a clothing company, and we had a property management company in Oakland. And we were there for many years. And as we decided to come back in 2012, we had a lot of overhead and a lot of opportunities. As we were trying to get in where we could fit in, individuals were looking for someone to fill the gaps. And we started providing locations for youth shelters, finding locations in real estate for the youth shelters to open up. We also had a location, the Hillman City Collaboratory on Rainiers and Orchids in the south end of Seattle, where we had basically full drop-in center, kitchen, housing, clothing, food, everything, service that we were just providing because of the stuff that we were doing just professionally in our own businesses. We weren't doing now in Seattle. We were trying to fit. But we had all the opportunity, all the clothes, all the food, all the locations, all the real estate. So we landed in this location because of the services we were providing to individuals. They would go to, let's cut it real short. Holidays, winters, and COVID showed up. The individuals who come to us for services, oh, help me. We were doing phones, free phones. They would come to us and they could sit down somewhere and eat. But when everything shut down, there were no, the buildings, the services, the providers were closed during COVID. But we were open. And we were told that we were like a necessity. The individual started going to their case managers saying, hey, take me over here. They took them over there and they got provided service too. They got food and warm and hot coffee and sat down. And the state recognized us saying, hey, that we're doing something different. You guys should be involved in this peer program we knew nothing about. So 2015 came around. My wife and I were both certified in peer counseling, thanks to the amazing Beverly Miller. When they sent someone, they sent her.
Yeah.
I think that was the most blessing in disguise that I could have ever had. And she made sure that we had every opportunity. She was still independently contracting with the state. So she hired us to handle things culturally. And she was very direct of the services she provided, and not just one side. She wanted everyone to have an opportunity. Like we wanted to provide, she wanted to offer. So it was a good merger.
Yeah. That sounds amazing. And, I think, you said earlier that this is the only Black-owned behavioral health organization. Did you say in Washington State? Yeah. I mean, I think many people understand why that's important, but can you speak to the importance of like having culturally competent services and the importance of like seeing, when somebody's looking, obviously I am not a Black person, but I am of the LGBTQ community. And I know for myself, when I was seeking recovery, it was important for me to see myself reflected back. Can you talk a little bit about the importance of your organization and the importance of what you are doing for your community?
Yes, it's very important for me to make sure I clarify that I am not the only Black leader and not the only Black organization doing good work in the communities in Washington State. But as far as the Washington State Healthcare Authority and the Department of Health is concerned, the ones they contract with, the ones who have the trainers, I am the only one, and I don't want to be. That's why I have my training organization. The importance to that is something that I've realized that I needed to be more of a relatable resource. And that was something that I started saying for many years, that I need a relatable resource. So I became that relatable resource. It's very important because as I was taking the opportunity to work for the bigger organizations and taking the opportunity to work for the larger independent contractors, I was noticing that there was no building, there was no gatekeeper or leader or whatever in my community that my people can just walk into. Just walk in, there's the services building. There's the people that look like you that you can trust and express your most intimate needs and wants and conversations with. So there was no one relatable. The services were there, but the relationship from the beginning was not. There was a lot of terminology coming down as far as meet people where they are. Well, I was always the one that said, well, if you want to meet them where they are, understand where they came from and how they got there. So that's what mattered to me, how they got there. I wanted to focus on that part.
And how do you do that for folks? Because there is a lot of this like meet people where they're at, and I think that's a beautiful phrase, and I think there's a lot of truth to it. But how do you get to that point where you're like identifying how people got to where they're at?
So that became very interesting to me because I had to show individuals, different people, how I came to that. And there was my whole proof of concept was just my daily life, my lived experience, my continual lived experience, my natural communicado with my natural community, I can go into those neighborhoods. I don't have a problem thinking that maybe it's not the right time or the right person or I need support or backup or whatever have you. I go there, they come to me. So my thing is that I'm not going to wear the tie. I'm not going to wear the suit. I'm not going to wear the badge. I'm going to be me. Because when they see someone like me coming as they are, they know that I know how they got there because I'm approaching them as someone with the experience. And we can tell just by the look, the talk, the walk, whatever, that you've actually been there before and not just read the book.
Yeah, absolutely. I think that, sometimes, people in sort of this field of work that we're in, we get looked down on for showing up the way that you and I are today because we're not in the suit and tie, we're not in the button-up shirt. And, I know that I remember when I first started sort of, like working at Pier Seattle and like being like, I wore a lot of button-ups and I started dressing down because I recognized that like, oh yeah, people don't look at me as relatable.
Yeah, no, I did the same thing. I actually cut all my hair off, wore suit and ties, and then my community was feeling very separated from me. And then they started putting me in a category that I didn't want to be in, that I was someone that wasn't approachable to them. So I just let my hair grow back and I just wore my normal clothes. And as long as I'm comfortable, they're comfortable as well.
Right. Yeah. People like to know, image matters, and, sometimes it's the reverse, like I'm not going to trust this person because they're too polished and put together.
Right.
And usually it's the reverse in our society, like you need to dress up a little bit more, but
you look for that, but that's old. Nowadays in a professional terminology, that will be more clinical. If we were looking for services. Nowadays, the relatable resources in a recovery model, not a clinical model. So when I see someone or they see me or someone that's able to provide services, they want to have someone that they can approach.
Yeah.
And if they feel that you're going to give them a good conversation versus a checklist, then it's a big difference.
Well, and I think that's a good point, even talking about like the clinical spaces. I mean, I would encourage and have encouraged clinicians to dress down. If you're working with an unhoused population, people who use drugs, people who live on the streets, and they come in and you're in a suit and tie, like they're already worried about going into a medical environment. They're already worried about going into a clinical environment.
Right.
And now they're in this like cold white room, sitting half naked on a piece of paper and, this weird bed.
Gone through a checklist.
Right. And this person doesn't look at all like they understand them.
At all. So it's different than you're dealing with someone on the street and you take them inside of a building versus someone on the streets, then you deal with them. Not, oh, you're a street person, but hey, I don't have to be always buttoned up. Because I tell individuals all the time, hey, when you go to your construction job interview, are you going to wear your Merrill Lynch outfit? And when you go to your Merrill Lynch interview, are you going to wear your construction boots and hard hat? No, you're not. So you're going to dress appropriately for the job or the occasion, right? So, hey, let's be comfortable.
Yeah, I agree. And, I think it actually earns people's respect. So you talked about, you have your own sort of lived experience. Do you mind sharing any of your own recovery journey and, how you got into this work and why it's important to you? At whatever level you're comfortable
So as
with.
my business, like I said, it kind of like eased into. I never opened my business up to say I'm going to do something specific. I opened it up to whatever I'm good at, whatever falls, I'm going to continue to provide that, right? But I was raised by my grandmother. She was a missionary. So I knew everything about feeding people on Wednesdays and Sundays and growing up in a church and going through all of the different churches and missionaries all up and down California coast. And when she passed away, it just stayed with me. And once I was away from my neighborhood and moved to other states and was involved in, I guess, the rest of the world, because I was just Los Angeles only. You know, it's hard to get away from your environment, you know. I was very, very complacent to a detriment. But when I had the opportunity after a lot of, I guess, let's say, hard times, I can define them as prison. Gang-related involvements and just a lot of unfortunates that was just part of my having to survive. Then I realized it's a big world and I wanted to do things differently. I wanted to give myself different opportunities, my family, my kids. But the missionary stayed with me. So no matter what I did and no matter what I do to this day, every service that I provide is always free to anyone that I encounter. I can charge it to the game. I don't have to tell you to pay me nothing. I just want to make sure everyone is happy, safe, taken care of, warm, clean, whatever. And I don't care what it takes. I'll go write all the proposals and the contracts and everything else just so you could have something. I don't even have to know you. That's just the missionary state in me.
Yeah. Well, and I think that gets lost often right now. You know, I'm not a particularly religious person myself, but, you know, my understanding of it growing up and, you know, has always been we take care of each other. And I appreciate that that's your approach, because empathy shouldn't cost anything. Human kindness shouldn't cost anything. Taking care of each other, making sure that we all have a place to live and a place to be warm and eat shouldn't cost anything. Do you find that there's pushback against that?
I do. Excuse me. I find that there's pushback because not only am I the only agency of color, I'm the only one that's for profit. Everything else is nonprofit. And so I disagree with them getting funding and it trickled down to staff. I don't deal with that. I just give to the people. So the pushback I see is that them not liking that I challenge what they do. Yeah. I tell everybody else, you don't have to go through that. No, they're just doing that for them. I'm doing it for you, and they don't like that.
Yeah, people don't like to be challenged. People enjoy the status quo. Because challenging the status quo means that you might be wrong.
Right. Or they'll tell me I'm wrong or I'm doing something wrong. So that's the pushback. It's always like, so then I'm always the only one in the room. I'm the only one doing something. So it's easier for me to be under a microscope. Mm-hmm. It's easier for them to look and find something finite about me that they can accuse or blame or judge on, versus all the others that's grouped into one kind of box and they kind of work together and do the same thing. I'm not. Mm-hmm. And I don't care or want to be. I don't disrespect you. I support you. I love you. I respect everything you do because we all need to do something. Mm-hmm. But I don't get the same respect in return because I'm not here to get no money. I don't have a staff. Every penny I get, I pay to independent contractors of color and programming and licensing and certifications for everyone else to have the same opportunity to do what I'm doing.
How do we continue to build up? I mean, because you talk about, you're training people so that you are not the only provider of these services. Like, how do we, as a community, support that work? Because it shouldn't fall all on you.
Well, it doesn't fall all on me. There's several good organizations, and they do good work. But my whole focus is to develop each and every individual, each and every community, each and every individual in each and every community to be independent, to have opportunity for advancement, not to get service. That's the difference. So if you want to stop with the individuals or the organizations that want to provide all the services, they providing all the services, how I feel, to be honest with you, and they're only going to do it as long as they're getting funding. I'm going to do it with or without. I've been doing that for many moons without funding. I'm not a nonprofit organization. I don't worry about grants. I don't fight against other ones, NPOs. I don't fight against GMOs. I don't fight against anything except I fight against maybe legislature because I want to bring to them in a very polite and respectable way the needs of my community, because they're going to bring that to me. They're not going to bring it to you. They're not going to bring it to these organizations. They're going to bring it to me. They're going to bring it to me and the people that I work with, the contractors, the trainers, and the people who provide the services that we provide. And they know my team. I have a huge team, and they're amazing individuals. I work with you. You're an amazing individual. If I need someone that can work with a certain field, I can call you and you can handle it, and you'll be trusted there, and we can grow like that. But any other way, that I don't have any reason to have to compete or compare. That makes it different.
Well, and yeah, the competition is weird to me. I always think the competition is weird because we're not going to over help somebody. Like we're in no risk.
But they can underhelp if they don't get enough funding.
Absolutely.
And I've been doing it for 2 decades without funding.
Yep.
And I've lasted longer than...
13 years is a long time for...
What are their average? 7 years, 10 years? They get their money, the funding dries up, and then they're not here?
Yeah, there's very few orgs that make it past, 5, 7, 10 years. So for you to be at 13...
And I was just with this one. I've been doing it for 8 years prior.
Yeah, so that's amazing. Yeah, I think we need to come together as community, and we need to work together on things because a lot of people have different things that they're good at, and it doesn't take away from another organization to say, "Hey, can you help this person I'm working with?" Like that it should just be about how do we help this person the best.
And that's the problem. Because being honest as a CEO, as an owner, and deal with legislature and funding and everything else. So let's just be real honest about it. It's a top down. They tell everyone else at the bottom, hey, work from the bootstrap ups. I never did that. I started the top down, right? Because I understand that it allocates itself and it trickles down. So when that money is funded, it starts at the top. They don't fund the bottom. They fund the top. The top has to be operated. The operations has to operate. They need management, executive, leadership, all these other operations, buildings, funds, leasings, cars, clothes, name tags, uniforms, T-shirts. By the time it get to the people on the streets, it's $12. I don't go through that. I don't need to deal with that. If I get any funding at all, every penny is to that. My office space and my services operate without anything. So the approach that I have and the I guess the approach that the community has that's open towards me is different than individuals that they have to go to and become a checkbox.
So what do you want to do next?
I want to open. I haven't done direct service in about 10 years.
Okay.
Right? Since the Human City Collaboratory. Well, actually, not that long. They closed. They sold the building during COVID. That's what made me open up my training center, right? But anyway, I want to open 2 things. I want to open up another drop-in center, and I also want to open up a big space for like conventions and summits and whatever yearly that individuals have, because we put on a lot of big conventions and conferences yearly, and we just have a lot of issues with the big name training spaces. When you show up at a hotel, it's a lot of things they want you to do that we don't have to do. And I want to, not deal with that. I want to open up my own convention center space, and I want to open up another direct to consumer space.
I mean, make your own rules.
Not do I want to, that's what I'm gonna do.
Make them. Let's do it.
Yes. So I can invite you over.
I would love that. What are some of the problems that you see facing us right now? I mean, obviously, like, we are in a tough political and legislative environment right now, both in the state and nationally.
Okay.
What are some of the barriers the biggest barriers that you see that you're trying to navigate right now?
Okay.
I know it's a really easy question. It's
very easy to answer, but to be honest with you, the hardest things that we ever discuss in behavioral health is politics, sexuality, and religion. And the answer to this is very political. And it's unfortunate. How can I say? It's very unfortunate the decisions the new administration is making, because it's causing a lot of hindrance to the state. So federally coming down, it's doing a lot of delays, a lot of terminations, and a lot of cancellations of funding partners and leaders in red and blue states. The problem that I see is that the funding is being canceled, stopped, or slowed down. To continue providing the service, it's not a political, it's not a racial, it's not a sexuality issue to me, to be honest with you. It's an economic issue. And that's the hardest part about it, because should I just say, no, I don't want to have nothing so I can be with the people? Or should I say, give me everything so I can give it to the people? Versus someone who gets it and then keeps it. So the biggest problem that I see right here, right now, and it's only moving forward, is the unfortunate decisions that's being made by the new administration. It's causing funding to stop, cease, or slow.
Yeah, and the chaos makes it really almost impossible to plan. I mean, even last week when we had, all of these grants being cut one day and then being restored the next.
Right.
It just creates this chaotic environment where people don't know what to expect, and it keeps people off balance.
Well, so I went to college for economics and econometrics. My internship was with Merrill Lynch, and I did an externship with the foreign currency market with Curex Foreign, the Forex market and the Pacific Stock Exchange. I understand investments and research and everything else, right? The number one thing that continues that is the volatility. And the only outcome from that is the economic outcome. So when you deal with individuals, we don't live on the market. Volatility doesn't make us feel like we're going to be better in the end. The market, volatility, the bear and the bull market, we can invest on the up and down and figure out where we're going to capitalize and feel better in the end. Humans and human nature don't live like that. Volatility just sends us in turmoil and depression and chaos. There's no outcome for us to say, oh, it'll be better if I did this, or it'll be better if I didn't do this. That's not humans. So contributing and comparing the market to human nature is a big issue to me. So I think that's where we should understand where we need to be just people.
how are you seeing people show up, because of this chaos? I mean, does it trickle down to the people that are most in need? I mean, I think we are obviously in a position where we are plugged in, and reading the news. Somebody who's in a more volatile situation, where they're unhoused, in active use, experiencing high acuity behavioral health needs. I mean,
I'm seeing more outcome from the children, from the youth.
tell me more about that.
I'm seeing more high school kids of color getting involved in student alliances and student unions. Student Congress want to learn more about civics. I'm seeing very, very young kids asking questions that only high school kids would have asked a decade ago. I'm also seeing parents, two-parent homes, single-parent homes, mom, dad, whatever the case may be, two moms, two dads, whatever the case may be. I'm seeing families bringing into their nurturing environment something political, so something that happens outside of their home. And it's not just something, to be honest with you, that I feel, or I kind of know that, Black people have to do all our life. Tell our kids how to respond to people when you get outside. Don't look, don't point, don't do this and this. Now it's on everybody. So now I think the entire base of humanity is coming back to being more human versus the separatism, because there's too much happening on each side and up and down and left and right. It could be black, white, green, brown, zebra stripe, polka dot. Something's happening to you. Yeah. And if you're not caring about that, then it starts to happen to you next. And they're starting to realize that.
Yeah, I think that's something I encourage a lot is, we can't become divided more than they are trying to divide us. But, whether you're Black or gay or Asian or trans, they hate us. They hate all of us equally. Like they don't discriminate on that factor. They may be going down a list and prioritizing who they go after first, but the goal is everyone.
The list.
Right. They want the list
The
gone.
list. Yes.
So we are stronger together.
And when you look at the list, we are all here enjoying our tranquilities individually in communities and together in communities, and understanding each other's separatisms and being respectful of that without coming down on each other. But the ones that do that are on that list. Mm-hmm. And so back to just being human, we're all the ones. That list is what we're protecting, is what we're fighting for. We can't do nothing about yesterday. We're not promised tomorrow. But today, right here, right now, let's think about who's on that list. The ones that come from the civil rights movement. Everybody on that list are here because of the civil rights movement. The same thing that they're trying to diminish to this day.
Yeah, absolutely. There's nothing they hate more than seeing us come together and, rise up together.
Mm-hmm.
So, we're running out of time, so I'm going to ask you one more question.
Okay.
What gives you hope?
You.
Well, give me more than that.
There's individuals like you that reach out to me and understand what I'm doing. I don't get offered interviews and to let the world know, or more people than I never met could just hear this or see this. It's like, wonderful. I'd like to know more about JCS. Yeah. So it's you and the individuals like you that gives me hope.
Well, and just to echo that, you give me hope. When I was working at Pure Seattle, I was just so impressed by you and Annette, and I tried to include JCS, and wherever I could include you, I tried to include you. And
thank you.
In my new role, I don't have as many opportunities, but, it's still something that's important to me, is to lift up these smaller, because a lot of these bigger organizations get so much attention. Mm-hmm. And then you have people like you that are just out there doing the work, and you're not looking for attention. You're not looking for screen time, but I'm happy to give it when I can. And here we are today.
Yeah. And I get to continue doing the work.
So yeah, you give me hope too. I mean, and actually, I said one more question. I'm going to ask one more question. Where is your office? Because I know you opened a new office. It was a Federal Way.
Federal Way, 34617th, 11th Place South.
And you do trainings there.
Training center.
Can people drop in? Like, what's the?
It's not drop-in center.
Okay.
It's my training center, my corporate offices. We operate everything: community life, peers on peers, peer support services, Christ and equity and culture, and we do everything to open up the drop-in center.
Okay. But that's coming.
Definitely.
Drop-in center and convention space.
Hey, but I got one question for you.
Okay.
Why are you happy today?
Why am I happy today? I've got a lot to be happy for. I have an amazing partner who is supportive and loves me. I have a great dog who is adorable and wacky, and I love watching her enjoy the world. I have a great job, and I'm happy to be in this space in this moment with you today.
Thank you.
Like this is, I try to be, before we started this interview, I told you, I've started using the term, I'm doing well contextually. And in this context right now, I couldn't be any happier.
Yeah. Because they said, my new one is, how you doing? Well, I'm doing good. And if I complain, I'll miss my blessing.
Yeah, because there's still good in the world, and we just got to keep it. Sometimes it's a little harder to find, but it's still there.
But I'm going to be here. I'm going to try my best.
I appreciate that, and I appreciate you.
Thank you.
Thank you. All right. Well, thanks, Javan. Appreciate you being here today. Appreciate your honesty and the work that you're doing in this community. We need more of you. So thank you for everybody who watched and listened. This is another episode of King County Recovery Conversations. Thank you, Temple of the Trees Studio. Thank you, King County Behavioral Health and Recovery Division. And thank you, King County Recovery Coalition, Washington Recovery Alliance. I don't know when this is going to come out, but Recovery Advocacy Day is Thursday, February 5th. So if it comes out before then, hope you can join us. If it came up after, then it was great. All right. Thank you all. See you next time. Okay.
Thank you, brother.
Thank you.